I think with Crohn's and colitis, what makes mental health support so important is because you actually have a chance to prevent long-term mental health issues. I think by definition, most people who have Crohn's or colitis have to live in a place of uncertainty around flares or symptoms or what's going to happen next. And that can cause lots of different symptoms of anxiety and even depression down the road. So having access and appropriate access to mental health supports ahead of time can help prevent some of those issues down the road. I think being a caregiver is hard, period, end stop. But I think when you're caring for someone who has such an unpredictable disease or a disease that relapses and remits, it can make it that much harder to navigate the responsibilities of a caregiver. So it really is just a matter of how do you juggle everything? And how do you witness someone who you love go through something painful, right? So I think having mental health supports for them not only is supportive for them, but also has a trickle-down effect for the person they're looking after. So mindfulness-based therapies, and there's several of them, really focus on teaching people to be in the moment. So not getting caught up about what happened in the past or thinking about what might happen in the future. So if you could imagine for someone who has Crohn's or colitis, for example, it's not thinking about how bad the last flare was or what the next flare might look like or when the next flare might come. It's about really enjoying what about right now? Is today a good day? So what can we do with that? So oftentimes mindfulness-based therapies will first teach that skill and then teach people how best to care for themselves using that information. I think the really neat thing about mindfulness, particularly for people who have Crohn's and colitis, is that, you know what, ultimately, some of the symptoms and the pain, there's not much we might be able to do with that in the moment. But what mindfulness skills do is they help change the relationship you have to those symptoms. And they help the relationship in a way that you won't be as bothered by them, and you'll be able to figure out how in that moment to care for yourself and to figure out what to do next. The ultimate goal of the research program is to develop a manual for an actual intervention for parents. So at the end of the day, this would be a manual for a 3-session online workshop that then could be shared with IBD centers, not just nationally, but internationally. And then by helping these parents, not only would it help their own mental health and their own coping, it would also trickle down to their kids. Right? So we've done some research out of sick kids, and what we found is that there's a positive relationship between parenting stress and certain behaviors. So overprotectiveness, for example. And when a parent is under stress and they're engaging in these overprotective behaviors, it actually has a negative impact on their child's reported quality of life. So what parents do and how parents feel matter in a child's life. Right? But what we found is that when these parents had high levels of mindfulness in their just everyday disposition, that impact falls apart. So they no longer, their own stress levels no longer impact their child's quality of life. So I'm really excited about this project because it targets parents. And oftentimes, especially in pediatric institutes, we don't really have the time or the resources to be able to support parents in the way that we would like to. So the ultimate goal and purpose of this program is to develop something that parents will actually engage in, because parenting is hard, and that much harder when you have a child with Crohn's and colitis. And parents are notoriously bad at taking care of themselves. So we really wanted to first and foremost really look at feasibility and what is going to be acceptable to these parents and what's a program that they will actually enroll in and complete. If people want to access mindfulness training or training specific to acceptance and commitment therapy, I think there's lots of different options. So some of the options is really nowadays there are apps for just about anything. So you can get guided meditations and learn some of the skills and practice some of these skills through the various apps. And I think I wouldn't recommend any specific app because it's about fit. And it's about, ultimately at the end of the day, which app do you like and which app are you going to actually practice using? So that's one way to do it. Another is to reach out to your family doctor to figure out who in the community is providing mindfulness-based treatments. Oftentimes, those are places that will know sort of the lay of the land and what's available in your community.